Welcome back to the program.
You got nothing off of me. You will never be one of the people.
Yeah, do you recognize that? That's Zoe Saldana in her role in the blockbuster Avatar. And a few weeks ago, this actress and the star of many other movies like the Star Trek series announced that she was diagnosed with a condition called Hashimoto's disease or Hashimoto's thyroiditis. So joining me now to shed some light on this autoimmune disease is Dr. Mark Engelman. Dr. Engelman is the founder and president of the Engelman Health Institute, and he is also a permanent clinical consultant for Cyrex Laboratories. Dr. Engelman, welcome to the show, sir.
Thank you. It's good to be on.
All right. Well, Hashimoto's disease, personally, it's not an infectious disease, so I don't know a whole lot about it. I've done a little research on it. So let's go ahead and start with my audience. What is Hashimoto's disease?
So Hashimoto's disease, well, first, they need to understand that something becomes a disease when there's symptoms and signs associated with it, and they put them together, and now officially someone has a disease. So I'm not a big disease label guy. So it's a condition, and it's called a disease. So it's playing with words, but I think a disease starts to make someone think that there's sort of nothing you can do about it. And as it relates to Hashimoto's, it's an autoimmune condition or disease. And what it is that we start chewing or going after our own thyroid gland is basically the easy definition of it. So we make antibodies which we're not supposed to make against ourselves. We make them against other things, foreign invaders and bacteria, as you know, and viruses and so forth. But we have lots of ways in our immune system to protect us from actually going after, I call it chewing on or going after our own organs, and one of them happens to be the thyroid gland, and Hashimoto was the one that described it, so now his name is associated with it, and it's now called Hashimoto's disease. Okay,
so the human body's produce an antibody that's attacking its own thyroid.
Correct.
Okay, so for my audience, my lay audience, can you explain what exactly is the thyroid and what's its function?
So the thyroid is the gland that's up in the neck near the voice box, and it has lots of functions, and every cell in the body has thyroid receptors. And receptors, usually the way hormones and most things do their job, is they occupy a receptor, and then that receptor sends signals to the cell to do something. So in this particular case, the thyroid gland is sort of our go fast or slow down hormone producer. So it regulates the rate at which calories are burned, so it can have an effect on, and frequently does, on affecting weight loss or weight gain. It can slow down or speed up the heartbeat. It can raise or lower the body temperature, and in fact, that's one way to diagnose whether somebody has too much thyroid or not enough. It influences the rate at which food moves through the digestive tract. Again, people that have too little have a tendency to have constipation, and people who have too much seem to have problems in the other direction. It controls the way muscles contract. It controls the rate at which dying cells are replaced, and it has, in that effect, it has to do with skin condition and hair growth, and it's really, it's a very, very, very important organ.
Okay. Now, somebody that is diagnosed with Hashimoto's, they may or may not have hypothyroidism. So what are the symptoms that you typically see with somebody with Hashimoto's?
Well, it's interesting because there are people who probably have Hashimoto's for their entire life, and their thyroid gland manages to work around it. So they may have no symptoms.
Right.
So if the effect is that you make or damage the thyroid or thyroid production and have too low of a thyroid, then those are people who have trouble with cold. They have an intolerance to cold. They get dry skin. Their eyebrows frequently thin on the side. They get these marionette lines in their face, that go on the mouth where the corners of the mouth are. And frequently they gain weight and they're fatigued. Those are the main ones.
Right. Now, what are the main causes, and is there any particular population that's more susceptible to getting this disease or condition?
Well, the sort of the theory about autoimmune, it's not a theory, it's really pretty well accepted, is that autoimmune conditions are people inherit the genetic predisposition to get them, whether it's rheumatoid arthritis, ulcerative colitis, Hashimoto's, lupus, all the autoimmune diseases that people know about. So we inherit the tendency or the predisposition to get those. But the theory goes, and it's pretty well accepted again, is that something needs to trigger those genes to go off and then start making mistakes and start attacking our own tissue. The autoimmune diseases don't start for no reason. So even if someone has a predisposition, doesn't mean they're going to get an autoimmune condition. The sort of the conditions need to be right for that to happen. So on patients that I see, and certainly the literature shows, is that families that have things like Hashimoto's have a tendency to have kids that are predisposed to have those things. So it's genetic linkage is certainly there, although it's not. If one person has it, that another family member has to have it. But genetics are definitely part of it. And then now the question is, what's the triggering mechanism to set it off?
And is that environmental stimuli, or
it is an environmental stimulus? You're absolutely correct. So the idea is that someone has, let's say someone has a problem with gluten, and not celiac disease where they can't digest gluten at all, but let's say they have a problem with gluten and they're sensitive to it, or they become sensitive to it. So how does gluten go from being outside of our immune system to going inside the system? And as a rule, what you do is you get a breakage or a leakage in one of the membranes. So the only really way things can get from outside of us to inside of us is they can go through the intestinal wall, they can go through the respiratory tract, they can go through the skin, and they can go through the urogenital tract. That's the way things from outside get inside. When I mean inside, I mean beyond the barrier, like the skin's the barrier, then they get inside. If you have a cut, for instance, now you're open to having things get inside, which aren't supposed to be there, that are normally outside. And since the gut processes, insane amounts of everything that goes by, I mean, what I usually do is tell people, well, just imagine that somebody gave you $1 bill, you didn't wash your hands, and then you put a cookie in that hand, and then you ate the cookie. Imagine just how many things in your, an infectious disease person and microbiology, how many just of those things are on there, let alone the question of digesting foods, which may or may not get digested. So the integrity of the membrane protecting us is, most people now believe that that's really where the problem lies, and that when that starts to get broken down, things start leaking in that aren't supposed to be there, and since they're not supposed to be there, our immune system goes after them. And then once it starts, that immune system gets turned on. The theory is people who have the genetic predisposition, have a tendency to make mistakes. So that immune system goes after one thing, but it sees something else that looks very similar to what it's going after, and it goes after that as well.
Yeah. Now,
and that's really how that's Hashimoto's, that's type 1 diabetes. And so the old theory was that, that you just got it. You just became autoimmune. The new theory is you don't. Something triggers it.
Is there a stage in life where you see this more frequently? I think Miss Saldana, I don't know, what is she? Is her 30s, I imagine? I don't know.
It seems that it's something that you get if it seems to be in either the teens or above. It seems to be more with women than men, although men can get it. But most autoimmune diseases are more prevalent in women than men.
Like lupus. Yeah.
And lupus, almost all of them, to be honest. And you can get it at any age, because once you start reacting to whatever that is that you're reacting to, you're subject to making a mistake. It's called molecular mimicry, which is, to the immune system, has no eyes, it has no brain, it just starts feeling its way around and seeing what feels familiar, and if something feels reasonably familiar, and then you have the genetic predisposition to have an immune system that might make mistakes, then you're sort of off to the races. So once that immune system gets triggered, most people believe that even type 1 diabetes, whether it's in the womb or first part of a child's life, because it's juvenile as a rule, and you're an infectious, did you say microbiologist or infectious disease?
Both.
It is that there is a predisposing and usually sometimes a respiratory infection, but most frequently a intestinal virus that sets that off, and that virus looks a lot like some of the parts of the pancreas, and so you get the infection first, and then you start chewing on your own pancreas, your islet cells. Next thing you know, you don't have any left, and you have type 1 diabetes.
Mm-hmm. Okay, let's go ahead and switch gears to how is Hashimoto's disease diagnosed?
It's diagnosed by getting a thyroid panel and making sure that you ask for thyroid antibodies, because they don't. If someone just goes to their regular doctor, and their doctor, in their course of getting their annual physical, as a rule, they'll just get what's called a thyroid stimulating hormone. And so what that does is that tells the thyroid to make more thyroid or less. So if it's thyroid stimulating hormones up, you make more, and if it's down, you make less, based on how much thyroid's floating around in the body. So let's say that somebody gets a thyroid test and just gets that. Then it may be normal, and if you don't ask for the thyroid antibodies, you wouldn't know the difference. I mean, you wouldn't know whether you have it or not. So it's a test you have to ask for. And if someone has things that are they just don't feel right, they have other things, maybe they have swelling in their hands, or, people know when things aren't right, and they come in to see a doctor that practices the kind of medicine that I practice, or a practitioner, they'll start thinking about maybe an autoimmune condition, and if they are, getting the normal thyroid won't be enough. You have to ask for the thyroid antibodies.
Okay, so that would be the anti-thyroid antibody test?
Yes.
Yeah. What about the thyroxine? That's not a test that you are concerned?
You do them to see whether somebody's, T4, which is one of the thyroids, or T3, which is the other forms, whether they're up or down. And those are useful, and I get them. But I think some people maybe wouldn't get the antibodies, unless something came back weird on their thyroid, and then they might get them. But what I'm saying is that some people have, normal thyroid function, and their TSH is normal, but they could still have, Hashimoto's brewing. So if you want to know if you have Hashimoto's, there's only one way, and that's to ask for thyroid antibodies. They're easy to get. They're not expensive.
Right. Okay. Now, how about treatment? How do you treat somebody with or without hypothyroidism?
So the treatment is based on whether they have too much thyroid or not enough thyroid. And so you would either, give something to calm the thyroid down, but as a rule, it's too little thyroid, so you would give someone thyroid. So, you can give them the T4, which is the sort of the one that's made in the thyroid gland, or you could give them a combination of T4 and T3. T3 is converted, once it's out in the system, it's converted in tissue. T3 is probably 4 times stronger than T4. So there are compounded and things that have T4 and T3 in them, or people get T4 on the assumption that somebody's body is going to figure out how to convert it to T3 and have a nice balance. What I do is, the other thing I do is when I get the antibodies back, I see what the level of the antibodies, because it doesn't just say positive or negative. It'll tell you whether the antibodies are high or low. Mm-hmm. And obviously, if they're high, that means that somebody's in a pretty elevated autoimmune reactivity condition. And it just happens that it's going after their thyroid, but you're not sure what else it's going after, if anything. But I'd rather have my thyroid antibodies be low, not normal necessarily, but low, which means that I have everything pretty quiet, pretty under control in terms of my own autoimmunity. But if they start getting up high, start getting worried that something else is going on.
Okay. Now, I read an interview with Zoe Saldana. I don't know if you're familiar with that situation. That's how I got to get in contact with you.
No, I don't even know who Zoe Saldana is.
Yeah, she's an actress. She's been in several movies. And she said in this interview that her and her husband changed their diets.
Yeah.
And went gluten and dairy free. Now, how does diet, I mean, you kind of touched on it already, but how does diet affect Hashimoto's? I guess.
So here's how it goes. No one 100% digests gluten. It's basically impossible. If you saw what it looks like, it's so wound around. It looks like one of those balls of spaghetti, sort of, that you couldn't, or you're trying to unwind. So it's very, very difficult to digest, and it also has some areas that are difficult to digest. When I mean digest, I mean cutting it into smaller pieces and then smaller pieces. So let's just assume that someone doesn't digest gluten well, which is everybody, and then let's say that somebody has a little leakage in their gut, it's called gut permeability, or now the phrase is leaky gut. Then that piece that's undigested drops into the, below that cell that guards the immune system in your bloodstream, and right underneath those cells that absorb the food and keep things in and out lie about 70 to 80% of your immune system is sitting there waiting to see what's good and what isn't. So once that gets in there, now you're off to the inflammatory and immune races, and now you're subject to attacking yourself. So the reason you would go off of those, and gluten seems to be the biggest culprit, and the second biggest is dairy.
Okay.
There's a lot of people that are sensitive. When we do the testing with Cyrex, there's a lot of people that have reactivity or sensitivity to gluten, and if you have reactivity to gluten, 50% of those people either also react to dairy or they cross-react. In other words, what they're making, the antibodies they're making to gluten, the dairy looks a lot like that, and so it makes a mistake and thinks that it's still taking gluten. So most people will take somebody off of gluten and off of dairy, but you can test for it, because going off of gluten isn't the easiest thing to do, and dairy isn't the easiest thing to do either. So I like to test for it before I just start pulling people off of things.
Okay. Now, when you're talking about the thyroid, you also have to talk about iodine. Do your patients have to have their iodine levels? I don't know.
So here's
their diet.
Here's the deal on iodine.
Yeah.
It's very difficult to diagnose low iodine, and a lot of people aren't even sure whether their results are accurate, and it's expensive. So what I've noticed is, I'll bet you, and I'm in Phoenix, Arizona, I'll bet you that 80% of my patients, and I have patients from 12 years old to about 99, and I'll bet you that 80% of them are on thyroid. And they all don't have Hashimoto's. Some do, a fair amount do. So I believe there's something in the diet, and it may be that we stopped doing iodized salt.
Mm-hmm.
That where are we going to get our iodine from? I mean, when you think about it, it used to be iodized salt, but now salt doesn't have iodine in it. So there are foods that do have iodine in them, and I would not go out and take an iodine supplement, because if you overdo iodine, you can get very sick, and then your thyroid can get really screwed up. So, but I can tell you what the foods are that have iodine in them if you want.
Oh, it's like, what, seaweed and kelp and stuff,
Seaweed's
right?
great.
Yeah.
I love seaweed, but codfish, yogurt, turkey breast, eggs, baked potato.
Okay.
So, so those are the foods that have iodine, and I don't know because we just don't test. If I had, all the money in the world and all the ability, I would take all my patients that come in on thyroid, and test them all for iodine just to see, and then publish the study, because every doctor I know sees patients, and when they come in, they're all on thyroid. Well, something's not right, because their thyroid's supposed to work. It's not supposed to not work. So that would be the most logical thing, and or autoimmune, because autoimmune conditions are just going up like crazy.
Yeah. All right, I got about a minute left with you, Dr. Engelman. You're associated with Cyrex Laboratories. Can you tell my audience about the services that Cyrex Labs offers?
So Cyrex Labs is I believe, the best at lab testing, and what they do is they test the integrity of the gut, of the intestinal system. So they look for leaky gut and see if there's problems with that. They have an amazing gluten sensitivity and celiac panel, as well as some people have problems with wheat that aren't even gluten sensitive. They test for all sorts of autoimmune conditions. In fact, they test for autoimmune reactivity. So they have lots and lots of panels. They have panels for brain, the neurological things like multiple sclerosis and other things like diabetes and all the things that you can imagine, lupus. So they test for those things, and those are the main things that they're known for. But it's an incredible company for testing. If somebody wants to know what's going on, or if they're on their way maybe to having problems that might show up as autoimmune disease later, because they're testing things that take frequently 5 to 10 years to show up as symptoms, this is definitely the company.
All right, excellent. Well, thank you, Dr. Mark Engelman, for your time and expertise, sir. I appreciate it.
Well, hopefully it was helpful.
It was. Thank you, sir.
Okay, thank you.